Let me take a moment and introduce our topic and our guest speaker for the evening. Tonight's guest speaker is Carly Berge. Carly is a certified speech language pathologist who holds a master's degree in speech language and hearing sciences from the University of Colorado. She's also an adjunct professor of speech language pathology at Moravian University, where she's run several clinics where they've offered free voice training services for trans folk at no cost, which is just amazing and has helped many people that I know. She's also the owner and proprietor of Lark Voice and Speech Services, where she focuses on occupational health for people who use their voice professionally. Finally, she's also a singer and a volunteer through the Threshold Choir, which is an organization that's dedicated to bringing music to people who are in hospice care. So that's really nice. Tonight, Carly's going to speak about voice modification for trans folk. So please welcome Carly Berge.
Thank you for having me. I am excited to be here and to talk about this. Thank you for that introduction. As I introduce myself, I do want to acknowledge that as a cisgender white woman, I am coming into this space with a lot of privilege, and I am aware of that. I do not presume to come in as an expert of trans voice or of trans topics. I view my role as one that is supportive and to help inform choices as they relate to voice, as they relate to transition. So we'll talk about a bunch of stuff tonight, but yeah, I came into this field because I love singing, and I also had some voice problems before I had any training. I got vocal nodules and had some issues with my voice because I kind of pushed it out all the time and didn't really know what I was doing. So I have empathy for kind of the process of learning to explore the voice and, make it your own. So tonight we're going to go over a few things. The first is I want to talk about the vocal cords, how they work. We'll go over the anatomy and physiology and talk about how we can optimize vocal health. We're going to talk a lot about the feminine aspects of voice, but I would say even if that's not you, if that's not your goal, I think the big picture discussions will be helpful. For each aspect that we talk about, we are going to do some warm-ups related to targeting that aspect, and then we'll also talk about conversational strategies. So as a therapist and as a clinician, I'm really invested in people becoming their own clinicians. And I hope at the end of this that you have kind of the beginnings of a vocal toolbox that you like and that you can kind of play with. And we will definitely take questions as we go. And yes, I had to throw in a Schitt's Creek GIF. All right, so let's say that this is you from the side. If we look at this picture, kind of the X-ray view of the head and the neck, I want to go over some structures here. So in the front, this yellow tube is your trachea. That's your windpipe that goes to the lungs. And then back here in the back is the esophagus that goes to the stomach. So I like to show this picture to kind of give a lay of the land of where the vocal cords sit. And they are right on top of that trachea. They're these two little, they look kind of like a slit in this picture. So in terms of where they're positioned, they're in a vulnerable spot to be irritated, either from anything coming up from the esophagus, like reflux, or anything coming down. So if we have a lot of mucus or postnasal drainage, those vocal cords are kind of in this intersection between what is draining down and anything that potentially comes up. When we eat and drink, this tissue here, this little kind of finger-looking tissue that comes up above the trachea is called your epiglottis, and that kind of comes down like a lid when you swallow. So just as a reference, when you eat and drink, food and liquid shouldn't be going down this way. And the vocal cord's main job, even more important than talking, is they protect the airway. So they protect us in a few ways. One thing they do is cough. When we clear our throat, they hit each other. When we swallow, they close. In addition to that kind of lid coming down, there's a couple layers of protection to keep stuff out. And when we hold our breath, they close completely. So all those things are good. We want the vocal cords to protect the lungs, but just keep that in mind as we talk about vocal health. Sometimes the vocal health aspects will kind of override what we want to do with our voice if there's a bunch of gunk in there, things like that. So that's kind of the lay of the land. This is another picture of the larynx as if if this is you looking at the screen, if we were to look in your body by kind of dividing you in front and back, this is the front. So the vocal cords come out. These are the vocal cords like this. They kind of hang out above the midline of our throat. So again, I think that's kind of helpful to see because air comes through this area. It causes the vocal cords to vibrate, and then out that air comes through the nose or the mouth when we're breathing. The shape of this is kind of important because in terms of pressure, it bottlenecks right at the vocal cords. So it takes kind of a balance between the air coming up from our lungs, the vocal cords vibrating, and then the release of that pressure out into the rest of our system. So it's just something to kind of think about as we go forward. If we were to look at the vocal cords from the top, they look like this. So they sit on top of the trachea like a V. So as you can see in this picture, they're kind of like this. They face the back. So for me like this, for you like this. When we're breathing, they're open. So they let air pass. When we want to talk or sing or laugh, the vocal cords come together and they vibrate. For somebody assigned male at birth, the vocal cords typically vibrate 100 to 150 times a second in conversational speech. And for somebody assigned female at birth, that's more like 200 to 250 times a second. They could basically fit on my thumbnail, those two vocal cords together. For somebody assigned male at birth, maybe a little bit longer than somebody assigned female at birth, also a little bit thicker. So it's kind of the analogy of like a guitar string. If one is a little bit thicker and you pluck that string, it's going to vibrate and make a pitch that's a little bit lower. Versus if you pluck one that's a little bit thinner, it'll vibrate quicker. There's less mass to vibrate. Again, and that's not set in stone, but that's just kind of the mechanics, I would say, at default. Here is a video of the vocal cords. Don't be scared. Let's see if you can hear this. Ooh, sorry about that. Bye. Okay. So yeah, the vocal cords, you can see they open when we breathe and then they vibrate really quickly. In this picture, the doctor is using a special stroboscopic light to kind of take multiple pictures of the vocal cords and show us how they vibrate, but really we can't see it with the naked eye. That vibration is happening kind of like hummingbird wings, actually like 3 times faster than hummingbird wings. So kind of cool. Oh no, sorry. How do I get out of that guy? There we go. The other thing I want to show you is just like a cross section. If we were to look at the vocal cords under, a microscope, there's a muscle layer, that red part of the picture. So the vocal cords are muscles. They're activated and controlled by our brain, but they're covered in a skin-like layer. And there's actually about 5 layers of epithelial skin-like tissue that covers them. So it's kind of cool because we bring the vocal cords together towards the midline of the throat as we're exhaling. That air flows through them and it kind of sucks them together. Pressure builds up but below those vocal cords, and then they're blown apart once the pressure becomes too great. Then, because the air and the mechanics happening, they kind of suck back together. Pressure builds up again, they blow apart. And it's, again, hundreds of times a second. So in order to get kind of the most bang for our buck when we talk about vocal cords, we not only want the muscles to be really flexible and agile and mobile, but we want the skin-like tissues to be super healthy so that they vibrate really well. The more evenly and fluidly the vocal cords move, the more clear, crisp sound we're going to get. E versus e. They're going to kind of hit each other and let pops of air out. So part of voice transition, part of voice modification, I would say, is just optimizing vocal health in general, giving it some attention, and kind of getting to know your system. Here's another kind of cross section. Okay, so when we talk about vocal hygiene or vocal health, one really important thing that everybody knows but nobody really wants to do is to drink more water. Physicians tend to recommend half of your body weight in ounces a day. I love it, Corinne, of anything caffeine free, and up to 1 serving of caffeine will count towards your daily hydration if you drink caffeine regularly. So there's kind of this myth out there that if you drink coffee, it's a diuretic, but if you drink it habitually, your body is very used to it and just fine, and it doesn't bother your system. It can trigger reflux, so I would say beware if you have too much, but I try not to take anyone's coffee away if they're not overdoing it. So drinking water is really important because, again, those vocal cords vibrate so quickly. They really need to be well lubricated in order for that job, that hitting over and over and over, for that not to be traumatic to the tissues.
Can we just stop there for a second? Because
Sure.
I'm not a coffee drinker, but I'm a tea drinker. Like a crazy tea drinker, like
Okay.
6 cups a day, right? 6 really big cups a day.
What kind of tea?
I'm an Earl Grey girl.
So it's
right?
caffeinated?
Oh, yeah.
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 All right.
Yeah. So are you telling me that for my voice, and I admit that I have more of a masculine voice, but I mean that I should cut back on my caffeine optimally?
Yeah, ideally, I think the more recent studies say you can have up to 250 milligrams of caffeine a day. So it depends on what you're having. I think a typical coffee is like 50 to 85. Okay. So you could probably have 3 or 4 even and be still pretty okay. But the other thing to think about is caffeine tends to trigger reflux. So if you have symptoms of like heartburn, regurgitation, voice loss, a really gunky throat after you eat or drink, that can be a sign of like stuff coming back up, and that makes your throat a little more acidic and more irritated. So yeah, but yes, in general, most people find, wow, I'm trying all these vocal techniques, but unless you're pretty well hydrated, it's kind of 2 steps forward, 1 step back. Your tissues are going to be working against some irritation.
Very good. Awesome.
Yeah, good question. Alcohol, unfortunately, also we can't count any of it. So if you have one, have some water. Another thing that I do tell people, especially in this group, is to consider something called steam inhalation. This does not replace your daily hydration, but it is what we call external hydration. It kind of is like taking those vocal cords into the spa. They just get a ton of hot air around them, and that condensation and moisture tends to give kind of a fast acting benefit. So people who sing, who maybe are performing, they might want to do this 15 to 30 minutes before a big talk or recording or something like that. And also, I think just in general, it can be nice when we're asking kind of a lot of the vocal cords, especially if we are maybe hanging out in a pitch range that's not what we're used to. Those vocal cords are working a little bit hard. So we want to kind of pamper them a little bit.
So there's a comment around seltzer, using seltzer, right? So I guess the question really I would have is, so carbonated beverages.
Good question.
Bad?
Yeah, it's in terms of hydration, it's perfectly great. It is very hydrating, just as hydrating as water. For people with reflux, we do add that additional, like, ooh, you might want to think twice because carbonation tends to trigger things coming back up. So again, if you have concerns of reflux or you're having voice issues, it might be something to play with, but I love a good bubbly water. So yeah, good question. Another quick note, there's a couple quick water tracking apps that people can check out. They're very simple, plant nannies, kind of juvenile, but it's fun because it'll help you to get some more water in. Another big part of vocal health is getting rid of anything that's hurting the vocal cords. So if you clear your throat a lot, like more than a couple times a day, it's hard on the tissues. Those vocal cords hit each other really hard and it can make things irritated. So I would say try not to. Easier said than done, but try to catch yourself. And then if you do feel like you need to do it, you can either swallow hard. So take a sip of water and kind of squeeze the muscles in your throat. Or you can swallow with your chin down. So I just kind of look down and I swallow in that position. Kind of squishes everything together. And if there's mucus in there, it's going to push it down instead of hanging out in some pockets. Okay. Last point on vocal hygiene is just what I would call mucus management. We all have gunk. We're kind of draining throughout the day, but especially if you have reflux or allergies, you might have excessive amounts of it. If you have any kind of respiratory issues going on, you may have mucus in your lungs that your vocal cords have to cough out. It is what it is. So there are some things you can think about to optimize mucus moving out of the way instead of dealing with it all day. Few quick things. If you sit up after meals, you're giving your body more time to digest. You are allowing gravity to, aid in food digestion versus if you lay down, it's much easier for stuff to come right back up. If you have allergies or concerns about allergies or drainage, sinus irrigation, like a neti pot or something called a Neil Med, can be really helpful to just clear out mucus this way instead of swallowing it all day. If you do have an inhaler, something called a spacer is something to discuss with your pharmacist. It can kind of separate out the medication that is delivered from all those kind of propelling particles, which can be hard on the voice. And in general, we also just want to, like we said, drink more water, but I would also discuss your medications with your physicians or your team, especially as many of you know, medications related to hormonal transition, medical transition can be super drying. So more water is more water for that. And then, like we said, try not to cough or clear if you can.
So just for what we're talking about there is really the impact of spironolactone
Yes.
as a diuretic.
Yeah. Yes, absolutely. Okay, so let's talk about some feminine qualities of voice. But again, if this isn't you, I think it'll make sense as we go. But the first thing I want to talk about is just simply pitch. Of course, many of us, I think the first thing we think about is pitch. It's kind of the quickest place to start, I would say. So this chart, and I want to say generally that any of the things I'm talking about here, none of this is prescriptive. Gender and voice, neither one exist on a binary. So voice is not going to need to fit neatly in any kind of category. If you love your voice and it is in a lower pitch, I am absolutely supportive of you. I think the data here is just coming from a point of unfamiliar listeners listening to a voice only. What gender do they attribute to that voice? This is where that data is coming from. So it can be a starting point. And you'll notice that there's a range. So for voices that were rated more masculine, they tend to be like 90 to 175 hertz. There's a gender ambiguous range. And the kind of sweet spot of that is in this 155 to 185. I tend to hang out about 185, so I'm not super high voice. And then for more feminine pitch, more feminine rated voice, we're looking at from like 160 up to 300 hertz, so 300 times a second. And if you sing, you can go even higher than that. I have had many clients who, when they're doing some vocal warm-ups, are going pretty darn high. So this can be a nice thing to think about as we go forward. So for pitch, I want to give you a couple exercises to start with. The first is called resonant voice M. You may call it a hum, but basically you're going to hold out the M sound. And you're going to see what you observe in terms of sensation. Do you feel anything when you make that sound? I went up a little bit because I feel it more in my face when I'm a little bit higher. So you might want to observe and kind of explore and see what you feel. For this exercise, you want to avoid super throaty feels like or like a sensation of only vibrating in the throat. So if you're noticing that, some things you can do to get out of it are to make your M a little bigger. You can make your, almost like say the word hum. Hum. We're kind of exhaling that sound and forcing some air to, your vocal cords are vibrating, but as that sound exits your face, it's bouncing off structures up here. So, anytime anyone talks about voice, they probably hear like M stuff. It's definitely pretty familiar to people, but we start with it because you can feel it. It's very friendly to kind of like, where am I in time and space? What am I doing? You want to get familiar with what is my body doing? What do I feel when I make sound? And then if you're aiming for maybe a slightly higher pitch, you might want to just try it on an M first. And almost what I call sounds good. Yeah, I'm going there too. I don't know about that. You want to kind of sneak it into your speech. So if you can get used to that sensation kind of peppered throughout your speech, it can be really helpful as you build resonance, which is again when stuff is vibrating up here. The other thing that if we want to translate that to more of when you actually talk, you can think about big picture. So instead of worrying about the minutia, do something that I call pitch variety. So studies also show us that people who have more variety in their pitch, so going really high and going low, that tends to be rated as more feminine. So if you can increase the variety of your pitch, that can help achieve some of that. Any questions before I add another one? Good. So another weird exercise that I'll show you is you can take a straw and a cup of a little bit of water in a cup, and you can blow into it with some voice. So when I say pitch range there, this is a way to increase your pitch range. So I personally can't go very high or low on an M without it getting throaty. Like that just isn't a great way to get up there. But if you do something like this, it's weird, but it helps your voice move around a little bit. You want to aim for bubbles. If I'm tense, I can do it, but no bubbles come out. So the kind of moral of the story always for voice therapy is we want air and voice to work together. So that's kind of a weird but easy one. Most people can do that. So get some chocolate milk.
We did have one question, Carly. Yeah. Can we use resonance voice M also to go lower in pitch?
Absolutely. Great question. Yep. I would say whether it's high or low, you want to be feeling that sensation in any direction. And I would only go as high or as low as you feel it in your face. So this is what I would call like a speaking voice range. Maybe when you sing or when you're, I don't know, calling somebody, you could be pretty high or pretty low. But when we're talking, the M is kind of a nice range to play with. But yeah, resonance in general is great for vocal health. It keeps the voice very efficient. So it's hard to do tense, which is good no matter what your voice goals are. But it also tends to be, again, I think giving you some landmarks as to like, what is my voice doing? So yes, up and down. And I always tell people too, whether it's the or it's the cup bubble thing, go as high and as low as you're emotionally comfortable. If you can expand the range in both directions, you may find that you have some more vocal choices as you go. All right, so another kind of quality of voice that we can talk about, especially as it relates to feminine voice, is what we call articulatory precision. So this is clear, crisp speech. If I'm wanting to increase the femininity of my voice, I can increase the precision of the sounds that I create. So it's, I would say, over enunciating or moving your mouth like 10 to 15% more than normal. You don't have to be a robot. It's not every single sound. We still want you to be you. But if you turn those up a little bit, not only are you keeping that air kind of coming out, it tends to be a little bit more feminine. If you're not aiming for that, you can do the opposite and be a little less clear, be a little more loose with those pronunciations, not letting it be as forward. So warm up wise, one way to do this is to go from an S to a Z sound. Sounds like S. I'm kind of keeping the S the whole way through. There's air flowing the whole time. If I'm tense, it sounds like so we want that, we want kind of air to get those vocal cords moving. You can also do a little glide. Same thing on an F to a V. Or an SH into like a zh. You zhuzh it. It's just kind of getting air flowing. It's a sneaky way to get more air in the system. So especially if you're noticing like, oh, my voice is kind of rough or it feels really low no matter what I do, when we bring out those more what we would call like strident or sibilant sounds, they're really high on the pitch chart. They're like 5,000 by themselves. They're super, super high. So they tend to, again, kind of add to the overall pitch perception. Another weird one to kind of get air flowing, which many of you, if you know me, have tried this, is just lip trills. I put my fingers right at the corners of my lips to support the lips and stabilize them as I let that air flow out. If I don't do that, I have to strain a little bit. And I don't like it. So play with it. Everyone's lips are different, but for me, that's why I do that. I'll drive and do one hand. But again, this is kind of like the cup bubble. Most people can go pretty high and low when they do this. I would even say try stringing a couple together. So that you're refilling. You need gas in the tank to kind of get those to work. All right. Another quality that tends to be perceived as more feminine for voice is something that we call light contacts. So it kind of feels like it's counterintuitive in terms of what I just said. Still want to be clear and crisp, but if you try to do that and also not hit your articulators hard, it comes out a little softer, a little lighter. So articulators being your tongue, your teeth, your lips. When you make sounds, when those things meet, you'll feel your structures kind of build up some pressure. So for example, if you say the sound or the words Coca-Cola, you're feeling some pressure when you make that K in your throat. Coca-Cola. If I do it kind of hard, Coca-Cola versus Coca-Cola. If I just try to keep it like not hitting as hard, Coca-Cola, or great versus great. 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 Sounds great. We just want it to be a little softer when it hits. It smooths out kind of the rough edges of the voice. Buckle your seatbelt. There's kind of some up there. Buckle your seatbelt versus buckle your seatbelt. I can't almost do it loud. So there is a bit of less volume with this one. We eat eggs every Easter. That one's hard. There's a lot of sounds. So we want to smooth those out if we can. So those are kind of warm up land. You can think about that. But say you want to just think of it big picture, maybe when you're actually talking, rate your volume. This is huge. I cannot describe how many people are just talking at like an 8 or a 9 out of 10 and don't realize it. If you can bring it down to a 4 or 5, not only will you probably have more vocal budget to last for your tasks, it tends to be read as a little more feminine. I think less maybe direct, less aggressive, if that's, a concern. Volume can be a little bit overwhelming for the listener. Try reading aloud. Again, maybe just noticing, what are my lips doing? What is my tongue doing? Where do those structures meet? And I always recommend that you create a list of what I call functional phrases. This would be things that you say a lot. Say them as part of your warm-up outside of those things. So if you make a call and you kind of give a spiel every time you make that call, that should be on your list of things. For me, it might be when I'm getting my kids ready for school and the bus is coming and I have a few things I say a lot, like shoes. We need to get shoes on. We're going to need to go in about 3 minutes. I practice that when I'm not with my kids so that it doesn't come out super intense and, like tight, but also so that, because I say it a lot. So then in real life, when I say it, I'm like, oh yeah, how's my voice? Well, how am I? Try not to hold it all in your throat. Another weird one is something called vowel prolongation or just connected speech. So this is the idea that from word to word, we want those words to kind of be strung together like clothes on a clothesline or like beads on a necklace. We want them to kind of be in the same line. So if I take a breath and I say, we were away a year ago, that's a sneaky phrase because it's voiced the whole time. But you can hear how it's kind of flowing from word to word. We were away a year ago. If I try to do that on that last one, we eat eggs every Easter. Even though there's a lot of breaks, I'm trying to connect that last sound to the next sound. So, hi, how are you is kind of a phrase. It's kind of one thing. Hi, how are you? Good to see you. I had a good weekend too. I'm kind of elongating the vowel part. I had a good weekend too. That part is a little longer. Versus if you're not going for feminine voice, you can be a little more choppy. If you want to kind of break those things up, again, that tends to be read as more masculine. And my little thing is blocking the last thing. What does that last thing say? Oh, shoot. Sorry. Boop. Oh, yeah, gesturing. So it's weird, but your brain is connected to, the rest of your body. So if you're trying to do something with your voice and you're doing this with your hand, it is surprisingly helpful. Hi, how are you? Yep, we're going to need to go to the bus. Whatever it is, if you can kind of get your body a little more fluid, it tends to help. Again, contrast that with some kind of choppy movements as you're talking. It's really hard to be connected and have choppy hand motions. So play with that if that's helpful. The Kleenex exercise is weird. They're all weird, but you're going to blow onto a Kleenex, just like an ooh sound, but first, no voice. So I'm just getting that really flowy air going. And you'll notice it's kind of a steady stream. I'm going to add voice and try to keep that same amount of air going. So when we're talking about prolonging vowels, if you want to break that down into just one sound, how are You. Good to see you. We want some air flowing, and that's just a sneaky way to kind of to play with it. Any questions so far?
So somebody said it's kind of like blowing over a bottle top.
Yeah, it is kind of like that. I think with that, you're maybe kind of aiming down, right? Like playing flute. That's more this way. So think out, but I even would say if you don't have a Kleenex, you can blow into your finger. Again, if you're tense, it's going to come out. Ooh, 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 ooh. I can make my voice come right out with no air. Ooh, versus some air flowing. So again, it's weird, but it's kind of a way to isolate one of those vowels and to feel it.
I have a question.
Yeah.
So in our household, somebody who shall remain nameless loves watching The Voice,
Mm,
right? And they, because for whatever reason, my spouse loves that.
okay.
But one of the things they talk about all the time is like head voice, chest voice. So is that a thing as we're kind of talking about feminization or
Sure.
masculinization of voice?
Yes, that's a good question. I think it can be confusing because, yes, singers say this all the time. And I think if it's literally what head voice is when your vocal cords are vibrating, they're still vibrating. Those bulk of the muscles are still meeting, but there are muscles on the larynx that also lift it, and it causes those vocal cords to stretch. So when we saw that video earlier, and there was like e, and then there was e, there's when you go up, your vocal cords lengthen and they tighten. So head voice is when those other muscles that are helping the larynx lift, they're a little more dominant, and it's a little more like hooty, a little lighter. It's maybe what for somebody assigned male at birth, they'll be told it's falsetto. It's really, if I'm in head voice when I talk, I'm still, I can even be in a pretty low pitch, but I'm like, I'm not letting the bulk of my vocal cords do the work. I'm trying to be a little lighter. So it can be helpful to think of it that way. Chest voice is like it sounds. I'm not really employing that lifting of the vocal cords. I'm just, most of us talk in chest voice day in, day out. Um, so I think for somebody who's maybe trying to increase their pitch range and maybe have some different vocal options that are higher, um, the the I would say the pressure that you feel when you're talking is probably less if you're in head voice. So it's something like, yes, it's a thing, but it's also, I don't know that it's helpful because it's very, like, those terms tend to be kind of nebulous. So I would say go more for resonance, go for airflow because they're more tangible. Um, and yeah, but like if you're doing cup bubbles and you're going from low to high and you feel like a break in between, you're going from your chest to your head. Singers work really hard to make that transition smooth, but you can hear kind of like a bump in the road if I really let you hear it. So really it's all the same larynx, but yes, when you go up into head voice, there's less pressure and less chest resonance versus if you are aiming for a lower sound, yeah, you may be recruiting even sensations, not just in your face, but maybe even the rest of your body. You may hear some volume and some pressure, and that can be okay. Sorry, it's
So,
not an easy answer.
that's great. So somebody had a question about, in particular for teenagers, but I think this probably applies to almost anyone. So if you want your voice to stay lower, and especially when you're nervous. So
Mm,
if you want your voice to stay lower, are there any tricks that somebody can, so maybe they're, a person who's a trans
yeah.
masculine? Yeah.
Yeah, I think in general, whether it's lower or higher, it probably comes down to kind of vocal control. Like, do I feel in control of my voice? Um, and I can relate to that. Sometimes I'll get a little higher when I don't want to. Let's see. Well, to not go high if you don't want to, and to practice that, I would say two things. In the moment is different than practice. So I would practice preventatively. I would really think about what are things I might be saying when I'm nervous. Is that like when I'm ordering coffee? Is it when I'm in an Uber? Is there a safety concern? Is there something where I feel like if I'm speaking high, I'm in danger? Practice those phrases so that you have some muscle memory of how to access them. And I would also say, even maybe doing an M into it, this would be more like in the moment. What do I do? You could do an M, which is pretty quiet depending on where you're at. Okay. And like use that M into whatever the phrase is, so that you can kind of hear what's going to come out. And if you're like, so how are you? Or whatever, that can give you a little bit of like, where is it going to land? The other quick thing I would say that's good for in the moment, if you are trying to sound low, if you can purse the lips a little bit when you talk, you're making the vocal tract longer. So vocal tract is anything from the vocal cords out. If you think of kind of the shape that would make inside, that's your vocal tract. So it's the difference between like a tuba versus a trombone versus a trumpet. We put air in them, but they make a different sound because that air has to travel through. So if we can lengthen and make the vocal tract bigger, you have a bigger instrument, you're going to have more sound, and you tend to have more lower sounds. So without sounding like a bro, it's a little hard not to like be like, yeah, dude, but play with that. Just a little bit longer once in a while can be a quick like, ooh. On the other hand, if you're trying to be a little more feminine, you can shorten the vocal tract by keeping kind of a smile posture. I absolutely hate the advice to smile more, so no, don't. But in those situations, if you can kind of smile through some of the words, it might be helpful.
I know that, so I do a lot of public speaking, and certainly pre-transition, when I was presenting male, and I needed to really get the attention of the room.
Mm.
So there were two things I would do. So number one, the power of silence is really powerful. The power of silence is powerful. That makes a lot of sense.
Yeah.
But when I wanted to get the attention of a room, I would just stop talking, and almost within seconds, the entire room would go quiet. And
Sure.
so that's a great way to create a sense of authority. And it also allows you to have a chance to kind of gather yourself. And
Yes.
then, when I needed to really kind of get
Like project.
deep, right? Is
Yeah.
I would, really straighten out my posture,
Mm.
and, almost like, you puff your chest out a little bit,
Right. That's
kind of you're
kind of
standing at
Superman.
attention, right? Because
Yeah.
you were, to your point, you're lengthening that track, right?
Yeah.
So you
Yep.
can get more air kind of through.
And probably recruiting like lower down muscles, like your abdominal muscles, and just making some more space and making yourself a little bigger. Absolutely.
Yeah.
That's great advice.
Yeah.
So, quick note I always like to add is just there are red flags out there. So, do not ignore if you're having major changes to your voice, like all of a sudden you feel like you lose your voice. Maybe you're singing Adele and you really go for it, and then you're like, whoa, my voice is gone. That can be a red flag that you're having a vocal injury and that you need to see a doctor. This can also happen if you cough really, really hard or if you've had any kind of surgery. So, any kind of surgery where you're intubated, it's a little hard on the vocal cords because that endotracheal tube sits between the vocal cords for the whole surgery. So, side note, if you're getting surgery of any kind, be a little bit of a diva about it and tell your doctor, like, can you please, use the smallest reasonable endotracheal tube, or say you're a singer, even if you're not a singer. I think they get like, oh, okay, we really want to pay attention when we intubate you because, yeah, maybe you don't want an intern to do that. And it is normal if you've had surgery to have some roughness for a couple weeks afterwards because your vocal cords may have some irritation, but it is not normal beyond 2 weeks. So whether it's like I had a cold and my voice just isn't getting better, or I had surgery and my voice just isn't getting better, don't ignore those, because vocal changes are not only important for your voice, but they can be indicative of other things, other scarier things that we don't want to ignore. That being said, too, any physical changes to your neck, like a lump in the neck, it would feel like maybe a piece of gravel in there, get checked out, because head and neck cancer is no joke, and yeah, don't want to ignore that. So,
So
other than
here's
that,
a
yeah,
question, and actually I was going to talk about this. Actually, two questions, so they're related. So,
sure.
the first one says after
Oh,
my,
sorry.
whoop,
I'll
is it
get
my
rid of
time's up?
that. I don't know what that is.
So after my 10-hour intubation, which was for various surgeries, said, my throat's still rough and it hurts 5 months later. Should I be seeing my PCP or a specialist first?
Yeah, you can go to your PCP to probably get to a specialist. The PCP might be able to do something short term if they haven't already, like a course of steroids or, antibiotics or whatever. They would rule out some things, but absolutely, if it's been that long, I would recommend seeing not only so an ENT, but specifically somebody who gets extra training in the throat part of ear, nose, throat doctor, is called a laryngologist. And they really, it's like some people are really great at ears, other people are really great at vocal cords. So I would see if you can find one of those. Um, yeah, if you need a specific person, you feel free to email me.
And this is something that a lot of especially trans femme folk talk about is vocal surgery, right? So this person had vocal surgery,
Mm-hmm.
and just and obviously every situation is different, every individual is different.
Right.
But what are your thoughts around vocal surgery versus vocal training?
Like a for voice modification. Um, I would say I wouldn't do it without trying voice training first. This is kind of the over the counter, like very low risk, option. It does take, I would say, like learning any new skill, it probably takes several months to be really proficient. But I would say for me to feel comfortable with your toolbox and for you to feel like I get it, I'm doing it, it's probably 8 sessions. Like that's why we chose 8 for the Moravian clinic that I run. And if any of you are interested, and please email me at that Moravian email. We are full for summer and fall, I think, but we're always taking people and would be happy to have you. But yeah, it takes some attention. And if anything, I find most people that don't, there isn't some magic change. What really happens is, wow, I took an hour a week to pay attention to my voice. I carved out that time and I built some muscle memory around what I could do. And I would say it would be good even if you decide to pursue a voice feminization or other type of voice surgery, because afterwards you got to recover from that surgery. Your vocal cords need to, it's almost like if you had a knee surgery, you would probably do PT after. If you get a voice surgery, you need to do voice exercises after, regardless. So these would be kind of in your toolbox already.
Yeah, and I think that and we're talking to a surgeon about doing a presentation on this in particular
Sure.
right now. We're working on scheduling, but
Yeah.
is uh, that it's important, I think, to know that. So I know some of the most beautiful and feminine women that I've known over the years have had, like voices for radio, right?
Mm.
Deep, resonant voices, and that everybody's different, and we sometimes need to embrace that.
Yes.
And it's just, somebody earlier in the comments mentioned that, it's it's not just pitch, it's your timbre and it's your pacing and it's, are you
Yes.
using your hands when you speak and all that
Right.
stuff, right?
Yeah, if anything, I would say most of the people who come to me, whether it's privately or through the clinic, they may only change their pitch 30 hertz. They may go from 130 to 150 or 150 to 180 or 100 to 130. And it is not necessarily a huge change on the pitch, but when they hear their voice back, when they have worked on it, it is, everyone's crying. We're just like, this is awesome. I would say pitch is the one that, again, that we kind of go to first, but that's why I think when you take some time and work on all the other things, it can be really, really helpful and give you
And
some more confidence.
there are smartphone apps out there that
Yeah,
do vocal pitch analyzation and all
sure.
that stuff, but they
Yeah,
don't necessarily hit those other pieces.
true. Yeah, some people ask me about those, and I would say they can be nice if you want some feedback of like, where am I? Like, maybe it gives you a starting point. But I always think really the best app is the one between your two ears. You need your own engagement in your process to be like, I know what I'm doing, I know where I'm at, I can kind of trust and embody my voice. And I'm always really happy when people tend to get more confidence and more awareness of just what their voice can do and what vocal choices they have. So,
Yeah, great.
yeah,
Well, thank you so much. We're gonna wait just a minute or two, see if anybody else has any other
sure.
questions. Somebody make a comment about cadence, right?
Okay,
And I
yeah,
think that kind of gets to what we were talking about is, the pace that you speak, kind of,
right.
the roundness of your tone and things like that.
Yeah, and kind of maybe that pitch variety where that meets um, pace. I feel like it's kind of both. It's like, how do I go up? How do I go down? But also the speed. It's to me a little bit of both. Almost like, is there a little sing song in the voice? Um, and what choices do I have? I often encourage people to like listen to voices that they love, even if that's not what you're going to sound like. If you love Meryl Streep and you're like, what is it about her voice? It can be really helpful to be like, oh, she's super connected. Or like that can be really fun. We had like Tim Curry or Gene Wilder or all different voices that are beautiful and interesting. And like when you embrace that they're very different and they can be um, you know, there may be little things you want to try on, like, and maybe the most congruent with voice with your gender identity is a voice you haven't really heard. So I would say explore. You don't have to be married to any of the things that you try, but give yourself some room to kind of feel out what you can do.
Yeah. We've gotten a couple comments here. There's people who've worked in your program at Moravian and given you
Hi.
lots of very positive feedback. So that's awesome.
Oh, good. Thank you
And
all for coming.
and just kind of speaking to, frankly, the importance of practice, right? That you do need to practice on an ongoing basis. Somebody has a question about, is it, recording your voice and then listening for feedback an important thing?
I would recommend that absolutely. Kind of in the same way that maybe we don't realize, like, oh, I say all the time, or I touch my face too much, or I whatever. Like it, that feedback is it can be really valuable. Most people hate the sound of their voice when they first hear it back. It can be a little jarring, but so there may be a cringe or two. But yes, when you listen to your own voice, it's the best feedback you can get. You say, oh, what did I like about that? What did I notice? And then just keep doing it. Every once in a while. Many of the clients have tried that just to give themselves kind of their own timeline of how their voice is changing.
So somebody asking, are there any types of exercises that you recommend that are easy for beginners to practice resonance? They feel confident in their pitch, but not
Yeah.
as confident in their resonance.
Yep. That M is the first one I would say. You could also do an N. Mm. Some people feel the N a little more than an or an NG sound like sing, just the no, no, like using that vibration kind of up here as a guide can be a helpful way to just get it from maybe throaty to more forward. So maybe you're not trying to go up or down, But if I'm like a little bit throaty, it doesn't sound that bad. It's okay. I don't feel that great. It's kind of hard for me to keep my voice this way. Versus if I start increasing the kind of stuff happening up here, whether it's flowy sounds, whether it's an N when it comes along, that can kind of make it a more of a forward focus.
Great. So somebody asking, how long can you practice, in a given day or at a given
Good
time
question.
without harming your voice?
Yeah, everyone is different. I kind of think about it like we all have a vocal budget. We have limited resources of just energy and time. So, warm up wise, when I see people, I say do a 2 to 5 minute warm up 2 to 5 times a day. So, little bits, but kind of frequently. So, maybe you have a Zoom call or you're going into a meeting, like tune into your voice. Give yourself a minute to kind of maybe you find that M, maybe you kind of like increase your airflow a little bit. Maybe we didn't talk at all about breath. There's a bunch of breathing stuff you can do too, but I would turn that on in the hopes that then when you go into your call, you're kind of riding that wave a little bit until you forget about it. So a little bit, but frequently. And if you talk a lot for your job or just in your life, I would say a good rule of thumb is maybe making sure that you have good 10 minutes an hour where you're not talking. So, space between meetings where you're completely silent so you can give those vocal cords a break.
Yeah. So we were talking before the meeting, but so in the business that my business that I run, we
Yeah.
do we build online training courseware for people, and so I'll do voiceover. I have people that work for me to do voiceover. Sometimes we'll hire a professional voiceover artist,
Yeah.
and we always do some of these vocal exercises before we start,
Yeah.
just to loosen up. And
Yes. It's
yeah,
like running, it's like stretching before you run. You're literally just getting blood flowing, the tissues are getting warmer, therefore a little more flexible.
yeah.
Yeah, good.
So there's a question from somebody who I happen to know is out in California.
Ooh,
So
fun.
they want to know if you provide online sessions.
I do. I see everyone virtually right now, and yes, I'm happy to see people from out of state. I have before. There's there's if you are there's kind of a gray area. So for voice patients that I see who have vocal injury, I'm only licensed in the state of Pennsylvania because there's insurance involved, and that is regulated by the state. But if we're talking about gender affirming care, voice training, absolutely, I can see from anywhere. But if you're like, ooh, I'm concerned that my voice is like I have a voice problem on top of maybe wanting to explore, I can find you somebody locally. But yeah, absolutely. I love seeing people online.
And you can provide that assistance for people who are looking to masculinize or feminize.
Yes, yes, I absolutely recommend whatever your goals are to consider training. A lot of people who, even after testosterone, um, it's very different larynx all of a sudden, and you maybe don't like have the same air flowing through there. It's kind of like you have the same lungs, but your vocal cords are now thicker and heavier. So sometimes there's some coordination and stuff that can really help with that.
Yeah.
Yeah.
Somebody asking a question about, are there any apps that you do recommend?
I can't say that there's any that I'm neutral. I know a few people have liked that Ava app. I know the person who
Yep.
programmed it or what it developed it, and I think that they're great. But like, no, I don't. I can't say personally that I love any of them or that I really have explored any of them
And
much.
any recommendations on how to find a speech therapist who really fits you?
Yeah, it is kind of a specialty. So I would say ASHA.org is the organization that licenses speech therapists. You can start there, put in your zip code under like find a provider. But that will give you everybody from like somebody who works with kids to stuttering to whatever. So you could start there and at least say, hey, do you know anybody? But honestly, I think I know one in every state. So feel free to email me if you're like, I'm looking for somebody in my state. I will try to help you. Yeah, we know each other. I would say most people are very generous and want to help get people this care.
And so you have two emails on the screen, one for your Lark and one
Yeah,
for at Moravian. Which one would you prefer that people use?
I would say either. Honestly, either's fine. If you're interested in the Moravian voice training program, that is local, that's free. Um, Feel free to email me there. That way, I can kind of keep you in that part of my brain. But otherwise, you can email me at lark@carlyberge.com.
Perfect. Yeah.
Yeah.
All right. Well, it looks like we have got no more questions. So
Awesome. Thank you so much for having
thank
me.
you for coming out tonight. You're
Yeah.
always a joy to work with. And I want to thank you for all the work that you do on behalf of our community.
You are so welcome. Thank you.
Yeah. All
Cool.
right, everybody. Thank you all for coming out tonight. We so appreciate it.
Yeah.
And
Thank you.
we'll see you next time. Thank you. Bye, everybody.
Bye.